Did you know that we do more surgeries in this country than any other country? For instance, we do 200% more back surgeries in this country compared to other countries around us, yet our results are not great. From surprising medical procedures to shocking revelations, we're about to lift the curtain and reveal the unseen truth. Get ready to have your mind blown as we dive into these unbelievable stories and secrets from clients to what the research says about some of the most common surgeries that we do in this country. We also talk about what you can do to avoid the surgeries and procedures, so listen to the end. Let's face it, there are a lot of myths and misconceptions when it comes to surgery. One of the biggest fears people have is the surgical team going to make a mistake? Will they truly solve your problem? Let's dive into some research that will shock you. So we're going to get into some surgeries on knee scopes. Now, I say this all the time. If you are over 40, having a knee scope because you have a meniscal tear or they want to clean it out, that's usually not the problem. And you're having a surgery that you don't really need to have that could be messing with your knee that could give you some future problems down the road. This is exactly what happened to me before I was a PT. In my 20s, I wish I never would have had that kind of surgery. When you look at the research on this, so they took people that needed a knee scope where they just wanted to clean out the knee. And they did a group of the people, they basically all they did was like poke holes in the knee, but they didn't do anything to the knee itself. So they looked like they did a surgery, but they really didn't do a surgery. The other clients, they went and actually did a surgery where they kind of cleaned up the knee. And so what the results were to that, as you know, the long-term results, the people that actually didn't have the surgery fared way better than the people that did have the surgery. And so these are some of the things that you've got to really get to someone that understands what's going on, because you could be doing something that actually might be doing more harm to you, especially later on down the road. Now, I'll give you another example of people with total knee replacements are in line to have total knee replacements. There's another research they did where they basically took people that were in line to have a total knee replacement. It was done in Canada, and they went and put them into two different groups. They went and put them in a group that was basically a McKinsey-based therapy group where they're going to do some knee mobilizations, whether it was like flexion or extension. And then they also put them in a group that they didn't seem to be in that category where it was just general exercise. Of the people waiting to have a total knee replacement, 40% of them just needed some knee mobilizations and their pain resolved within 2 weeks. It was really quick. And so these are people that are having total knee replacements, 40% of them. So if that's the case, maybe it's something that you might not need, and maybe there's something else out there that actually could help. I'm seeing many of my friends that are in their early 50s having total knee replacements when there's some other things that they could have done that probably could have prevented them from having that. Okay, let's go into MRIs. That's another big one that we see all the time. Let's go get an MRI and let's see what it is. Well, when you look at the research on MRI, it's not great. Like as you get older, the more things it shows. So it could be 60 to 80%. So when we're in our 40s, maybe 60% of the stuff is going to show. By the time we get to 80, it's like 80% of the people are going to show something. Whether it's arthritis, a meniscal tear, a rotator cuff tear, it's going to show something. That's just normal wear and tear, very similar to us having like wrinkles on our face as we get older. It's just a part of aging. And so you've got to be careful with getting an MRI because that could have been there all the time. And so we, when people get MRIs and they come to our office, we'll do our full evaluation and we're basically going, that doesn't make sense, that doesn't make sense, and that doesn't make sense on your MRI. This is where it probably could be. So you really got to get someone that understands. And honestly, if they didn't even have an MRI at all, we would have done the exact same pathway. The MRI does not help us in any way unless we think there's some red flags that are going on or something's not making sense. Let's go take a further look. But the majority of the people that we see don't need this. And a lot of times it will lead to more procedures down the road, or not even down the road. It just leads to more procedures when we do testing like this, because you're going to find something. That's why when someone's really young and they're like, maybe they're 14 and they get an MRI and it shows something, I'm like, that's probably true, because when you're young, you won't show anything, because most of the time on MRIs, it's just the wear and tear that we see. So next one, when you get one back surgery, it leads you to the second and third back surgery. And why is this? Because you aren't sure what you did. Your back just started hurting one day. You're not sitting there talking and understanding like what you're doing throughout the day that may be causing some of the problems. You don't have that. So you go see a doctor, they do an MRI, they go, okay, yeah, let's do injections. They didn't work. Okay, let's do surgery. And when you do the surgery, you don't have the understanding of how this happens. Like if it's from a car accident or something like that, completely different. But when you're just not really sure what you did and you started having back pain and it's getting worse, there's things that you're doing throughout the day that are creating some of those things. So when you have the surgery and you go back to those same activities, guess what? It comes back in about a year and they're like, yep, that I knew that. That's why we did the conservative surgery, but doing a discectomy or a laminectomy or something along those lines. Now we need to go and do a fusion. And so then you start going down this path. Now, many stories that we have from our clients on different things. And since we're talking about back, let me just start there. We had a client that literally went into the doctor and they said they had back pain and the doctor said, have you had physical therapy? Yeah, about 5 or 6 years ago. Okay, so you've had physical therapy, check that box. You've done injections, check that box. Okay, so we'll go in and let's just go ahead and have surgery. So he was waiting in the waiting room, literally with all these people in the waiting room to have back surgery, and he was asking them questions. Every single one of them was on their second and third surgery, and he was like, oh, I'm a little scared about this. So then he went into the surgical room, and the nurses were asking him, okay, so what's your pain level? And he said 0, and the nurse was like, their face was like, what? It's 0? He goes, yeah, I don't have pain in the morning. I have pain as the day goes on. And literally he got up off the table and he goes, I don't want to have the surgery, and walked out. Luckily he found our office, and in about 5 treatments he was back. He understood what he was doing, what was going on, what he could do to fix himself. And he was like, I never needed to have the surgery. But these are common stories that we see, but we also see the reverse where we have people that have had like 5, 6, 7, 8, 9 different types of back surgeries, and they are so messed up, and it's so hard to fix things that you can't go back and redo. And all of them would have said, I wish I never would have done this. I wish I never would have had these back surgeries because it's not helping, and now I'm more dependent on medications and all these things. But we, again, have been able to help them navigate that a little bit. But man, when you've had that many surgeries, it's just hard. It's hard to get back. So those are just some other stories. Let's go into another example. Rotator cuff tears, very common to see on an MRI as we get older, very common. So we had one person that we were in contact with, and she was like, yeah, I have a rotator cuff tear, and decided not to come in, and she ended up doing therapy somewhere else. It didn't work. She ended up doing stem cell. She ended up doing I think myofascial release. She did all these different things and said, okay, I guess I'm going to have a rotator cuff tear. And I begged her, please come in so we can actually look at you and see if that's really what's going on. She didn't. 3 months later, she was in even more pain. She could barely lift her arm up. I mean, it was like barely lifting it up. She would spend probably an hour in the morning just stretching so that she could function enough throughout the day because she was in so much pain. So when I finally reached out to her again and said, someone's missing something because they're not fixing the right problem. And I said, when you get your low point, call us. And so about 2 weeks later, she called, she came in. We went and looked at her, and I was like, we're going to rule out the spine because that's really common for things that can happen in the shoulder. So we went and looked at her range and stuff, and she's like, yeah, a little stiffness, but it's not that bad. Her range wasn't that bad. But I'm like, but we're going to rule it out. Kid you not. We went and did some retraction extensions in her neck, and got up, retested her shoulder. She goes, oh my God, I can move my shoulder. My pain is 60% better. This is crazy. I go, yeah, this was a neck problem, not a shoulder problem. She wished she never would have had that rotator cuff tear. We had another client that was in line to have a rotator cuff tear. Luckily, she had called our office, and she was like, but I've already tried therapy. And I'm like, yeah, you did the basic rotator cuff exercises, but what if that's not the problem? And what if they're doing surgery on a part that really isn't the problem? Because let me just tell you, a lot of people will have rotator cuff tears and they have no pain. They don't even realize they have it. They can go in and get an MRI and they have no pain, and they'll show a rotator cuff tear. So is it really that, or is it something else? So she came in and we looked at her, and it actually was her thoracic spine. She was so rounded in her thoracic spine, and that was what was producing pain in her shoulder and even difficulty moving her arm. And so we went and showed her some shoulder stretches that she could do. that would like mobilize the thoracic spine. We did a lot of manual work. And after about the second visit, she goes, I canceled my surgery. I feel so much better. Thank God I did not have that surgery. So these are just things like, we always say where the side of the pain is not often where the source of the problem is coming from. So what can you do about this? What are some takeaways from this? Really, the takeaway is you've got to be conservative. Do conservative care. And even if that conservative care didn't work and you're asking them questions and they're not critically thinking through stuff going, we've ruled this out, and explaining everything, you're probably not at the right place. Because when people come into our office, we're sitting down having a conversation. And sometimes that conversation could be 30 minutes to 40 minutes before we actually even move them, because we want to understand all different aspects of it. And then after we do our evaluation, we're basically explaining these are all the areas that we see problems with, and this is what we're going to start with. And we're basically testing and retesting to understand like where is the source really coming for you. Because let's take a shoulder, for instance. It can be a neck, it could be a thoracic spine, it could be a shoulder issue. But we have to start going in and ruling some of these things out to figure out where it is. So it can take 2 to 3 visits, but if we can get to the source, golly, then it goes much faster. So you've got to be very conservative. You want to get to someone that actually understands the body and can help navigate this for you. Again, I can tell you our office, we probably only send maybe 2 people to surgery per year. We have 4 therapists. That's amazing. And that's what we want for you. And us really helping navigate that and understanding like, this is what the next step looks like. So for you, maybe it's not our place, but you know what? We have someone that can take care of the emotional piece. Or if we feel like it's a different specialty, we have those specialties that are already set up for you. We're kind of like the family practice of physical therapy, of really helping to navigate the body for you. So those are my takeaways. Make sure, surgery is there. We can always do it, but make sure that you do a conservative route before you go in and dive into surgery, because let me just tell you, doctors make money off of surgeries. Hospitals make money off of surgeries. Hospitals want you to do surgeries. They hire the doctors that do the most surgeries. They want that income, and that may not be right for you. So make sure it is and get to someone that really understands that. If you like what we're saying, please share this video, like this video, subscribe to our channel. If you have any questions on anything, comment in the comment section. What is your experience with some of the doctors that you have seen, so that we can hear from you, because we hear crazy stories all the time, and we'll help you in any way that we can.